the chairman in the sense that certainly we need a fair, simpler tax code. I would say, though, that I don't think anybody on the panel is trying to say that the cruise industry is not paying what we as a Congress have said that they need to pay. And we have a number of individuals that feel like that they're not paying enough taxes that are very prominent, but I don't see any of them voluntarily paying more. So if there is a blame, again, we need to work on that and get a fair, simpler tax code. And I think the cruise industry would agree with that because that would help our economy and be good for a number of different reasons. The other thing is, and I appreciate Mr. Johnson and the Senator from Alaska, the cruise industry truly is, we talk about contributing, but the many millions of dollars, how, Ms. Duffy or whoever, what is the size of the industry? What does it represent in the United States as far as?
In 2010, Senator, the North American cruise industry generated $37.85 billion in U.S. economic benefits, including nearly 330,000 U.S. jobs.
Yeah, so it's a huge entity, and the other thing too is that, and again, I'm a guy that believes that we need adequate rules, to make sure that for safety and lots of things safe. But probably, Mr. Johnson, the risk of having a significant accident driving to the pier in Miami is greater than getting on the cruise ship and going wherever you're at. The other thing is I'm really interested in the disease aspect of this. I'm an optometrist by training, but that's a huge problem, and I know that the industry itself is working really hard to figure that out because it's a huge negative. We all read about those things, but it is a difficult problem. I know that if you listed the hospitals throughout the country, you're probably much more likely to go into the hospital with a minor problem and then come out with a significant infectious disease, percentage-wise, than again on the other. So these are things that we all need to be committed to grapple with, and we'd like to work with you. Ms. Duffy, will you walk us through, in your testimony, you talked about how things are continually in the process of evolving. When you run into a problem, a significant problem like an outbreak or this or that, what are the steps that the industry goes through to identify that and then try and put procedures in place?
The cruise lines currently, on the issue that you've raised about public health, meet or exceed all the federal codes and regulations and the international requirements. Every ship undergoes regular inspections, crew training, and we are in frequent communication with the CDC directly if there is any sort of an outbreak. There are regular inspections also under the VSP, or Vessel Sanitation Program, to ensure that all of the ships operating from U.S. ports have the appropriate and exceptional food handling and sanitary practices. Actually, one of the former VSP sanitation chiefs said that the CDC program standard to which cruise ships are held for sanitation is among the highest in the world for any public places, I think, to your point about hospital outbreaks or outbreaks that we've seen in schools. So our members are very committed, obviously, to ensure that we have a very healthy environment for our passengers and crew.
We'll do Mr. Johnson, then you, Dr. Klein, if that's okay.
This is a good example, a perfect example about how a port at a local level works with the Coast Guard, works with Customs, works with the Center for Disease Control in particular on these issues of a health issue. You have obviously the issues of disembarking passengers. You have the issue of the queuing for embarkation for another cruise. You have the importance of sterilizing the cruise terminal itself. This is an area, again, to the point of continual level of interaction, both at the security level. Your ports are only secured because of the cooperation of all agencies, federal, state, and local. And it starts really with U.S. Coast Guard. I can't say enough good things about the Coast Guard, but Customs, federal, state, local interaction, and Your level of security, your level of safety is only as good as that level of clear communication, clear cooperation. In the health area, that's a specific one. We're engaged. It could be literally, and to hold a ship over, instead of departing my port at 4 p.m. as scheduled, you know, it may be a midnight, 1 p.m. Those passengers have to be properly handled, dealt with nicely. But again, it's an important issue that we deal with.
If I could add, Senator, the reference to CDC is an important one. The CDC does have the lead for vessel sanitation. The Coast Guard has a very close relationship with CDC. We rely on them for advice on operational controls that are necessary to control any outbreak. So if they feel a ship needs to be detained in port or prevented from entering port or remain at anchorage, we can apply those controls on behalf of CDC, and we have protocols in place to do that.
Thank you, Ed. Dr. Klein?
Yeah, I just want to say a couple of things. First of all, I won't dispute the statements about sanitation. I think the VSP does a fine job. I also want to say that I'm sympathetic to what the cruise industry deals with. I distinguish between sanitation and norovirus, which isn't related to sanitation. It has to do with people not washing their hands when they go to the bathroom. It follows the fecal-oral route. We know that. The industry in 2002, in response to a major set of outbreaks, came up with the mantra, passengers bring it with them. They continue to say that today. However, I know of an analysis of data from the CDC which indicates there's a fair number of incidents where when there's a passenger outbreak, it is preceded by an elevated number of crew members reporting ill. This disputes the passengers bring it with them. Also, that there are outbreaks on successive cruises suggests passengers aren't bringing it with them. Need to make two comments because I indicated in my oral statement that there are disincentives to reporting. Generally, I understand that crew members who report ill are kept off work for 2 days or until they're asymptomatic. Makes perfect sense. However, one continues to shed the virus for 2 weeks. One continues to be contagious if you don't properly wash your hands for 2 weeks. But these people are back at work. As well, passengers who report ill are quarantined. Again, makes sense. But there's a disincentive. If you're a worker and you're not working, many of them say they're not being paid. If you're a passenger, why would you report being ill if you can still go out and enjoy your holiday even if you don't feel well? So the people don't have an incentive to go out of circulation in order to deal with preventing the spread of the illness. The other thing I want to say, and this is anecdotal, so I can't stand up and say it's truth, but anecdotally I have heard from crew members who say that the chemicals used for sanitation, for dealing with the illness, are so caustic that it isn't uncommon for them to replace the chemicals with water because it's so hard for them to apply. Now, that may be happening 1 in 100 times, 1 in 1,000. But I think there needs to be a greater attentiveness. Rather than, again, saying passengers bring it with them, we're the victim here, I think there can be more of a proactive dealing with the problem.
No, I know I'm over, Mr. Chairman. I apologize. I guess the only thing I would say, Dr. Klein, and I don't disagree with the problem. So much of that is just doing right. You know, it's just hard to, to get somebody to wash their hands. And then the other thing too is, additional those that are watering it down now. It doesn't matter what regulation you put on them; they're still going to water it down. See what I'm saying? I mean, that to me is absolutely crazy because the result is that outbreak, you turn a little problem, regardless of the cost into this huge problem. So again, it's difficult things to deal with, and
well, I entirely agree, and I'm sympathetic to the industry. I guess my feeling, and it doesn't need to be reflected in legislation, but my feeling is they could go further than they currently go, and I'm more than happy to share with them my views and my insights.
Yeah. And I think that's very appropriate, and I think that's what this is all about. It's just trying to get some information out so that we can, really help each other because it is an important resource. I've been to Ketchikan and places like that. There's nothing else. And they really are great contributors, kind of a bright spot with our economy.